How to get accurate skin biopsy results. Have you ever wondered how to ensure that skin biopsy results are as accurate as possible? Getting the right diagnosis starts with a few essential steps. First, selecting the optimal biopsy site is crucial. You want to choose the most representative area of the lesion. For inflammatory skin diseases, a punch biopsy is often preferred. This technique uses a 4mm punch to capture all layers of the skin, from the epidermis down to the subcutis. For raised or superficial lesions, a shave biopsy may be more appropriate, but avoid areas that are ulcerated or necrotic, as these can yield non-diagnostic tissue. Next, the biopsy technique you choose should match the suspected diagnosis. A punch biopsy is ideal for most inflammatory conditions and some neoplastic conditions, allowing for full-thickness skin sampling. A shave biopsy is suitable for superficial lesions confined to the epidermis, like superficial basal cell carcinomas or warts. However, it is not recommended for suspicious pigmented lesions because it does not reach sufficient depth. For larger or deeper lesions, excisional or incisional biopsies may be necessary. Proper local anesthesia and careful tissue handling are also vital. Use just the right amount of local anesthetic to avoid distorting the tissue. If you use too much, it can mimic dermal edema and interfere with the diagnosis. When handling the tissue, be gentle to avoid crushing artifacts. Use fine forceps without teeth to transfer the specimen and minimize contact to prevent squeezing the tissue. Once the biopsy is taken, it's important to fix and transport the specimen correctly. Place the biopsy in at least 10 times its volume of 10% neutral buffered formalin right away. This helps preserve the tissue. Be careful to avoid drying or contamination with excess blood, which can obscure important details. Washing off excess blood with saline before fixation can help prevent misinterpretation. Providing detailed clinical information to the pathologist is another key step. Include comprehensive details about the lesion's history, appearance, and location, along with any relevant patient information. This context helps the dermatopathologist interpret the biopsy accurately. In some cases, additional tests may be needed. Depending on the clinical suspicion, you might request ancillary tests like immunohistochemistry, special stains, or molecular studies to improve diagnostic precision. Finally, follow-up is essential. Accurate diagnosis often requires correlating biopsy findings with clinical examination. If necessary, a repeat biopsy or additional testing may be needed. In the context of skin cancer and healthy skin, these steps are vital for distinguishing between benign and malignant lesions and guiding appropriate management. Emerging technologies like laser-assisted biopsies and molecular profiling are promising tools for the future, but they currently complement standard biopsy procedures rather than replace them. In summary, to get accurate skin biopsy results, focus on careful site selection, appropriate technique, meticulous specimen handling, detailed clinical information, and close collaboration between clinician and pathologist. This approach ensures reliable diagnosis and effective management of skin conditions, including skin cancer. Always remember to consult healthcare professionals for personalized advice and guidance.